Good afternoon, everyone. Welcome to all members and guests to the November 7th, 2023 Board of Health meeting. I'd remind everyone that our meetings are web streamed and televised, so please ensure that your phones are on silent. For those attending virtually, please mute yourself when not speaking. When called upon to speak, please turn on your camera and unmute yourself. Staff in attendance, please remember to use the Microsoft Teams hand raise feature to be called upon and remove it when you are finished speaking. With that, I will call the November 7th, 2023 Board of Health meeting to order and begin with roll call, confirming that all members of Board of Health are present. I'd like to begin today by recognizing some upcoming Remembrance Day services. Many local legions and communities are honoring our past heroes through various service throughout Norfolk County, and I encourage everyone to attend these gatherings to recognize and celebrate our local veterans. I'd also like to quickly read a poem from the Ontario Command Legion Military Service Recognition book to begin today's meeting, followed by a moment of silence. The poem is called Never Forget. They gave their day to end the night. They fought the dark to bring the light and gave their lives so we can be free. Never forget the heroes. For our great nation, they offered all and deserve to be put in fame's great hall. They gave their today for our tomorrow. Never forget the heroes. A glorious and free Canada came with sacrifice. So remember those soldiers who paid such a price, who truly could say, we stand on guard for thee. Never forget the heroes. And with that, we'll take just a full moment of silence. Okay, thank you very much, everyone. The first item on the agenda is to approve the agenda or make any changes. Are there any changes, or do I have a mover and a seconder to approve it as printed? Moved by Board Member Huffman, seconded by Board Member Michelli. All in favor? That's carried. Are there any disclosures of pecuniary interest today? Being none, we have no consent items, no early closed session, no deputations, and no presentations. There are some minutes to approve. Item 9.1 on the agenda is the Board of Health minutes from October 4th, 2023. Is there a mover and a seconder? Moved by Board Member Vandendriessche, seconded by Board Member Brunton. All in favor? Carried. Item 10.1, we have the October info break item of communication. Would any board member wish to pull this for further discussion? If not, a mover and a seconder to approve it as presented. Moved by Board Member Columbus, seconded by Board Member Duthie. All in favor? Carried. And on to staff reports. 11.1. We have Dr. Locke, Medical Officer of Health. Would you introduce the report?
Through you, Madam Chair. So I'll just give my report. So my report is generally self-explanatory. I'll just highlight a few things. I'll just bring to the attention of the board members that the Association of Municipalities of Ontario has set up a health transformation task force that was started in August, and part of their what they'll be looking at is public health services. They plan to meet regularly over the upcoming year, and as minutes or notes from their meetings come out, I will relay them further to the board. The other thing I'll just bring to your attention was there's been some progress on strengthening public health, which is an initiative that has 3 strategies. One is includes the issue of encouraging voluntary mergers between health units and to provide input into the whole issue of voluntary mergers. The ministry has gathered together a key informant group. They have already been meeting, and their report is expected out shortly. In the interim, further direction has come from the ministry regarding the criteria for mergers and their objectives for their outcomes, and we will present a full report on that at the December meeting. I'll just also draw your attention to 2 items that are in later on in your board report. It's not yet directly mentioned within my report, but I'll take the time to mention them now. The Alpha has its November meeting. It's done remotely. It's from November 22 to 24, and we do encourage Board of Health members to attend. And lastly, I think that's about it. Yes.
Okay, thank you very much. Are there questions? Board Member Van Andrieschie, then Breton.
Thank you, Madam Chair, and through you. Talking about the criteria that's for voluntary mergers, is there a criteria that would tell us that under size, if it's too big, we couldn't join with them, or is there any criteria like that? Or because our discussions were, we thought of Brant and we thought of Elgin because of our similarities. Is that still possible, or is there something that would tell us we can't do that?
No, that is still, through you, Madam Chair, that is still possible. The one criteria regarding size is that they prefer health units, the new entity to be merging, the new entity to be serving a population of about 500,000. They will make exceptions. So, for instance, in the north, where the population is very sparse and the geography is very large, it doesn't make any sense to have a geographically extraordinarily huge health unit. So there they'll go for smaller numbers, but here in Southern Ontario, they're preferring a population served of 500,000 or more.
Board Member Breton.
Thank you, Madam Chair. My question through you to Dr. Locke. Is there, I got a discussion the other day regarding the RSV shot and pneumococcal pneumonia. Is there any similarities to those 2 shots? They're both respiratory, are they not? Or
Yeah.
Let's put, sorry.
For you, Madam Chair. So the pneumococcal vaccine has been around for a long time, 15, 20 years. It's against the bacterial infection that causes pneumonia. And it treats about 23 different strains. It's recommended for those over 65, or if you've got immunocompromising conditions. The RSV vaccine, the V in the RSV stands for virus. So it's against the respiratory syncytial virus, which is another one of the respiratory viruses that circulates every winter. It tends to impact children the most, and by children, even very young children, because it clogs up their bronchioles and they end up wheezing and having a hard time breathing. But it can also affect the elderly. There's just the RSV vaccine is brand new, and it is this year being recommended for a very in addition to young children, it's being recommended for a select subgroup of elderly. So they're giving it to the elderly in long-term care homes. But for the general population, it's not recommended. The RSV, so RSV tends not to cause problems in the healthier age brackets. It is a respiratory virus, but it tends to cause problems in the wee little children and sometimes in the adults. So that's why it's not.
So is the pneumococcal like a one-time vaccination, or is it something that has to be done every few years, or like the RSV is relatively new now?
Yeah.
Like, is that something that will be recommended every few years, or I guess it's too early to tell maybe?
Yeah, the pneumococcal gives you long-lasting immunity. So there's usually one shot's required. Occasionally, for some subsect populations who have weaker immune systems, a second booster is required 5 years after the first one. But then, even then, they're pretty good for a long time. The RSV vaccine, I haven't yet heard on the frequency at which it will be required.
Thank you.
Board Member Columbus.
Thank you, Madam Chair. And Dr. Locke, can you bring us up to speed on the latest status of COVID-19 in Hull and Norfolk?
So there is, we still have a large number of outbreaks in our long-term care home settings, in our congregate living settings, related to COVID. So the COVID virus is still definitely circulating within the region. At the provincial level, there was a slight rise in the number of cases, which we measure by something called the percent positivity, or the number of tests that come back positive in the beginning of the fall. But right now, the numbers at the provincial level are falling again. So at the moment, it's a little bit on the wane, but as the winter comes on and we're more indoors, we're again waiting to see what will happen, whether it will rise again.
Thank you.
Any other questions? Does someone wish to move to receive it as information? Moved by Board Member Berry, seconded by Board Member Huffman. All in favor? Carried. 11.2, Syed.
Thank you. Through you, Madam Chair, I would like to introduce Sarah Titmus, Program Manager for Infectious Diseases, to introduce this report. Thank you.
Thank you. Through you, Madam Chair, to the Board of Health. Good afternoon. As Syed mentioned, my name is Sarah Titmus and I am the Program Manager for the COVID-19 response team. I have both the infectious diseases team and the COVID response team within my portfolio. And today we'll be presenting report number HS23052, respiratory season, and ask that the Board of Health accept this report as information. So what is respiratory season? Well, this is known as the time between November 1st and April 31st, when respiratory viruses are circulating at their highest levels in our communities, and infections from those viruses, in particular influenza, tend to peak. Monitoring and surveillance for respiratory viruses does occur all year long, and this has shown that in the case of COVID-19, that it is not a seasonal respiratory virus, but rises and falls in numbers all year long, which is typical for a novel coronavirus. So why does this matter? Well, respiratory viruses generally affect the respiratory system, causing symptoms such as fever, cough, runny nose, sneezing, sore throat, headaches, and muscle pains. All those symptoms of what in most cases will be a common cold may in some people become severe illness due to worsening infection, leading to bronchitis, laryngitis, sinusitis, ear infections, or pneumonia. And on top of that, for those at higher risk for illness, people aged 60 plus, immunocompromised persons, pregnant people, First Nations, Inuit and Métis communities, international agricultural workers living in congregate living settings, residents and staff of long-term care and retirement homes, and those unvaccinated are also at risk for severe outcomes, such as long-term side effects, hospitalizations, chronic conditions, and even death. So what is the public health burden to the community? Well, in order to understand the public health burden for Haldimand Norfolk, the health unit undertakes surveillance and monitoring of respiratory diseases. This is conducted through receipt of positive lab results for cases of COVID-19 and influenza A and B in our jurisdiction, as well as reports of acute respiratory illnesses in our high-risk settings. So for our highest risk settings, we would receive positive lab results for COVID-19 and flu, as well as those for acute respiratory illnesses that go on to be identified as things like parainfluenza, rhinovirus, or human metapneumovirus. For overall respiratory virus activity, you will see in graph 1, which is on page 4 of the report, that influenza A and B follows the traditional seasonal pattern, peaking in November and then tailing off into April. And in contrast to that, COVID-19 demonstrates peaks and troughs throughout the entire surveillance season. While COVID-19 is no longer in its pandemic phase, our communities are continuing to experience illness due to COVID-19, and influenza cases have also continued to rise as COVID-19 related public health measures were further relaxed across the province. From an outbreak perspective, the majority of outbreaks in our institutions tend to be caused by an acute respiratory illness. However, COVID-19 is the exception, since it has caused institutional outbreaks throughout the years during the pandemic period of 2020 to 2022, and continues to do so post-pandemic. So with all that being said, what do we do as a health unit during respiratory season? Well, we have 4 main focuses, which are for the infectious disease and vaccine preventable diseases teams predominantly, and they include vaccinations. So as we've already talked about, the Ministry of Health has once again launched its COVID-19 and influenza vaccine campaign. Vaccines are aimed at reducing the risk of severe illness from these 2 viruses. And COVID vaccine clinics are now offering the XBB vaccines, which will target the most recent Omicron strain. And for influenza, high-dose quadrivalent vaccine for high-risk people is also available at local pharmacies. Both the COVID-19 and influenza vaccines were made available to the general public towards the end of October, and so now the vaccinations can be received by all. The Ministry of Health has also announced public funding for the RSV vaccine for those 60 years and older living in long-term care home, elder lodges, and some retirement homes. And the VPT team is beginning to deliver this product out to our long-term care homes as we speak. We then move on to another very important area of focus, which is health education. This is a key piece to prevention of illness from respiratory viruses. Health education is aimed at promoting an understanding of how to maintain personal health, and this would also influence population health by decreasing not only individual cases of respiratory virus infections, but also outbreaks of respiratory illnesses. Key health messages this year include get vaccinated, practice effective hand hygiene and follow respiratory etiquette, stay home if you are sick and don't visit high-risk settings, and know your risk for respiratory viruses and get assessed. Information on all of these topics in relation to respiratory season are available on our website and social media platforms, with radio ads and targeted messaging planned for the winter months. In particular, as well as being up to date with your vaccines, it is important to know your personal risk level for COVID-19 and influenza. This is a newly focused health education message. Those at risk for severe outcomes from COVID-19 should have access to COVID-19 tests at home, and those at risk for both COVID-19 and influenza should speak with their healthcare provider and pharmacist to develop a treatment plan in advance in case of potential infection. Another area of focus is surveillance, which we've already talked about. We look at the public health burden of respiratory viruses. This is also conducted at the international, national, provincial, as well as local levels. Local data gets rolled up for inclusion at an aggregate count level and assists with assessing the effectiveness of the influenza and COVID-19 vaccines, as well as controlling the spread of respiratory viruses. Needless to say that the work carried out at the international level starts with local level surveillance and management of respiratory diseases by our healthcare providers, hospitals, institutions, and public health units. That then leads us into our last area of focus, which is outbreak management. So we focus our efforts here on our highest risk settings, including long-term care homes and retirement homes, hospitals, congregate living settings, and employer-provided accommodations for international agricultural workers. Outbreak management includes collaborating with facility staff to define and investigate cases and contacts in the outbreak area, testing for respiratory viruses and ensuring antiviral medication orders are in place, infection prevention and control guidance, and recommendations on surveillance strategies. Looking at the outbreak pattern in our institutions during the last respiratory season, there was a total of 44 outbreaks, which is approximately 56% of the confirmed outbreaks managed for the surveillance year. Such a concentration of outbreaks requires the ID team to prioritize outbreak management and follow up for high-risk diseases of public health significance during this time. So with all that being said, what can we do to help? Well, as the Board of Health are respected members of our community and can be advocates for this important public health initiative, we ask that you speak positively about the benefits of immunization, get your flu and COVID vaccine every year, practice hand hygiene and respiratory etiquette, stay home if you are sick, and in particular for this respiratory season, know your risk for respiratory viruses and get assessed. Thank you. I'll open it up to questions.
Can you hear us okay, Sarah?
Yes, I can. Thank you, Madam Chair.
I think we're back on. Are there any questions from board members? Okay, seeing no hands. So mover and a seconder to receive the report as information. Moved by Board Member Micheli, second by Board Member Van Passen. All in favor? That is carried. And the last staff report is item 11.3, the 2023 Haldeman Norfolk Health Unit Funding and Accountability Agreement Budget Amendment, HSS 23059. Syed.
Thank you. Through you, Madam Chair, I would like to introduce Michael Van Sickle, Senior Financial Analyst, to present this report. Thank you.
Thank you, Syed. Through the chair to the board, report HSS 23059 being presented is with regard to the most recent accountability agreement between the Ministry of Health and the Board of Health for the Haldeman Norfolk Health Unit. For some background, the Health Unit submitted the 2023 annual service plan in March based on the Board of Health's approved 2023 operating budget and allowable one-time funding requests. On August 29th, the ministry sent approved funding allocations to each health unit. For base programs, the ministry communicated before the release of agreements that all health units would receive a 1% mandatory funding increase for the years 2023 to 2025. For the Haldeman Norfolk Health Unit, this amounts to an increase of $41,175 for 2023, as seen in Table 1. Due to the ministry operating on a fiscal year, the health unit will receive an additional $13,725 in 2024. There are no other adjustments required for base programs. For one-time programs, requests have been split into Tables 2, 3, and 4. Table 2 outlines the calendar year requests, of which all 3 were included in the approved budget. As expected, the ministry has confirmed mitigation funding and furthermore announced that the cost share will return to a 75 provincial, 25 municipal split from the previously reduced share of 70-30. This change will be reflected in the proposed 2024 Board of Health budget. COVID-19 programs have not received an approved allocation. However, the ministry continues to fund eligible costs at 100%. Table 3 gives the fiscal year requests with programs for a public health inspector practicum position, a new vaccine refrigerator, and secure card access requiring a budget amendment. The School Focused Nurses Initiative and the Strategic Option Analysis were included in the approved operating and capital budgets, respectively. Table 4 provides the requests that did not receive funding approvals from the ministry. The ministry has communicated there will be an opportunity to apply for in-year funding. However, it is not yet known what specific projects will be deemed eligible to apply for. At the Health and Social Services Advisory Committee meeting, a question was asked if the levy savings of $61,200 noted on page 4 of the report, just below Table 5, could be used to support requests listed in Table 4 that were not approved by the ministry. Should the board wish to move forward with any of these projects, an alternative recommendation would be required. And with that said, I would be happy to answer any questions. Thank you.
Thanks, Michael. Are there any questions from board members? Board member Duthie.
Thanks, Madam Chair, and through you to staff. I asked this, I believe, at advisory committee related to the items listed in Table 4, the not approved items, and I understand that on the staff level there is some sort of a plan to action those items. I wonder if I can maybe get a comment from staff on that.
Thank you. Through you, Madam Chair. So the first one is strategic plan process facilitator. We asked $30,000 from Ministry of Health. So as part of capital plan, Board of Health already approved $20,000, and currently we are in a process of developing our strategic plan within that amount of $20,000. So that's in progress. So we are good there. The second item was website modernization. We were getting feedback from the public that health unit website is not user friendly. So we asked Ministry for that $122,000 for one-time funding. So currently we don't have any support or any financial support from the ministry or from Board of Health to update our website. In-house, within our limited resources, we are doing something like deleting information which is not updated or which is not required. But that project is kind of on hold for now. The third one is electronic medical record. Currently, we are using around like 10 to 12 different softwares or databases for our different programs. So we ask for an electronic medical record so that we can have access to clients' information, especially from hospitals, from other health units. So that's a challenge for us. But in the meanwhile, what we are doing is we are utilizing or planning to utilize some of the free databases like Clinical Connect, which will give us access to some of client health information. And in addition, currently Ministry of Health is doing a review of the whole EMR of the province, and hopefully within next few years, there would be one system for the public health units where you can have access to client information. Thank you.
Any other questions? Okay, there's a recommendation before us. Is there a mover and a seconder? Or does someone wish to propose an alternative? Board Member Columbus, the proposed? Seconded by Board Member Duthie. Any debate, discussion? I'll call the question. All in favor? That is carried. Thank you, staff. We have no more staff reports. We don't have any notices of motion. Does any board member have any other business? we will not be entering into closed session today, so we will finish up with a confirming bylaw. 2023-10BH, mover and a seconder. Moved by Board Member Michele, seconded by Board Member Huffman. All in favor? Board Member Huffman, a motion to adjourn at 1:29, seconded by Board Member Duthie. All in favor? Carried. We'll be back at 2 o'clock sharp for special council meeting.